Dr. Deuk, and I'm here with one of my patients on, what is it, September 9th, 2020. Now you are here one day after your back surgery.
Correct.
Right?
Yes.
And you had 3 herniated discs in your lower back.
Right.
That were causing horrible back pain, correct?
True.
We tested them during surgery, and one of them caused a 10 out of 10 pain, the other one 10 out of 10 pain, and the other one 9 out of 10 pain. And you said, yep, that's where my pain comes from. Now remember the pain you had just yesterday before your surgery. How long have you had that pain for?
Well, I've had it for, what, probably 7, 8 years, probably.
7 or 8 years in your back pain. And you lived with it for 7 or 8 years. Did you try to get rid of it?
I did. We did a couple of cauterizations and stuff like that here. Okay. And those worked for a while, but, you know, it just,
All right, so what he's saying is he had chronic back pain for about 7 or 8 years. He came to our facility. We tried using the needles to fix the pain, doing a rhizotomy. It sounds like it worked for a little while, but ultimately, rhizotomies only fix pain from the facet joints. And this gentleman had pain coming from his discs, from the herniated discs. Herniated discs do cause back pain because the back of the disc has nerve fibers on the disc right where the herniation is, and that herniation goes through the tear in the back of the disc and causes inflammation. And it's the inflammation within the tear in the back of the disc that's innervated by nerve fibers. That's where the back pain comes from. So we did the Deuk laser disc repair. It's the first surgery in the world. It's all FDA approved, first surgery in the world that treats the annular tear and gets rid of the inflammation. Now the pain you've had for the last 7 years, can you tell if it's still there or if it's gone?
I believe it's gone. I mean, I do have some soreness there, but it could be from the surgery that
Correct.
Moving through the muscles.
Yeah, so the soreness you're having, if you don't mind, that discomfort right in here, right? That's sore.
Yeah.
That is from the muscles. That's going to go away. But remember the pain you had in the center of your back? You still have that pain?
No, not
gone.
Right. Yeah.
Cured.
Yes, I think so.
Well, it is cured. It won't come back. So for those people out there that don't know that back pain can be cured, it can be cured. You just need to do the right procedure. And we tried curing his back pain with a rhizotomy. It didn't cure it. But then we did the disc surgery, which is what he really needed, and we got it done.
Right. Yep.
So what are you going to do now that you're not going to have back pain anymore?
Well, I'll try to get back to my golf game and, try to get back on the road. We did a lot of traveling, so trying to get back out on the road with our camper and, just back to enjoying life.
Good for you.
Yeah.
All right, good. Is there anything you want to tell the rest of the world before we sign out?
I highly recommend, that you research and get your back fixed through Dr. Deuk here. He did a great job. And so that's about all I got to say. I'm enjoying life now.
Good for you. I'm happy. Is there anything you want to say? All right. Thanks.